My name is Kim Howe. This is for Respiratory 251, spring of 2023. I'm doing my recording on extubation today. So first things first, I'm gonna look at my patient's chart, looking at my name, date of birth, MRN number. I'm gonna look at my physician orders, which state that my patient needs to be extubated. I'm looking at my chief complaint, code status, chest x-rays, labs, and ABGs. So I'm gonna go ahead and wash my hands, get some gloves on. And test my equipment, checking my ambu bag, make sure the mask is inflated, make sure that the valves are working properly. I would make sure that I have my code box on standby just in case we need to re-intubate my patient. I have a nasal cannula, got a yonker, my syringe, stethoscope, and goggles. And my paper towels, well, these would be my towels, but for when I get done extubating him, that way he doesn't get it all over him. So I would take these off, throw them away, go in my patient's room. Hi, Mr. Smith. My name is Kim. I'm from Respiratory. I'm here to see if we can get that tube out today. So I'm gonna go ahead and wash my hands, grab some gloves. Move my table over here. How you doing today, sir? Okay, so I'm going to look at his ID bracelet. I'm looking at his name, his date of birth, and his MRN number. And I'm gonna check his level of consciousness. Is your name John Smith? You can squeeze my hand. Great, okay. And is your date of birth 8/15/72? Great, okay. And are you ready to get that tube out today? Okay. So can you lift your head to my hand right here? Great. So now that I've assessed that, I'm looking at his work of breathing, his overall color. I'm gonna check his tube depth to make sure that it matches what I have in the chart. And it's saying 25 at the lip. Okay. So now I'm just gonna check his pulse, and I am checking his heart rate, his respiration rate, his SpO2, his blood pressure, and his EKG. Okay, everything looks good there. So I'm gonna check his vent and make sure that his graphics look good, and make sure that he doesn't have any leaks going on. All right, grab my blue bag, stick this at the head of the bed, and I would plug it up and flush it out. That way I have it ready in case we are ready to extubate. Okay, all right, Mr. Smith, go ahead and give you a listen. And I would listen to each segment for one full breath cycle. I'm also just gonna feel ready from it. Okay, all right. So while I'm doing that, I'm just gonna go ahead and give you some oxygen, okay? So we're gonna go ahead and give him an O2 boost. And while he is hyperoxygenating, I'm gonna go ahead and check my suction pressure, so that will be on, and I would make sure that it's between -100 and -150. Move that on. Okay, pick that back up. Then I'm gonna check my cast tube and make sure that this suction is between -20 for continuous and -100 for intermittent. All right, so it's all ready. His ventilator is looking good. So I'm checking his heart rate, his respiration rate, his SpO2, his blood pressure, and his EKG. Everything looks good. Okay, Mr. Smith, I'm just gonna get you suctioned out. So I would have this yonker and it would be in a sheath, and I would just place that at the head of his bed. Okay, so first thing, I'm going to draw back 5 mils of air. I'm gonna flush this cast tube out. Okay. All right, Mr. Smith. I'm about to suction you out, okay? So I would unlock this. All right, we ready? cough, okay? And until I meet resistance, and then I'm gonna pull back 2 to 3 centimeters. I'm checking my heart rate, my respiration rate, my blood pressure, my SpO2, and my EKG. Okay, we're gonna lock that back. And then I would grab my Yonker. Okay, Mr. Smith, I'm just gonna suction out your mouth. Get in the back of his throat, the sides of his cheeks, making sure that we get any secretions. Good job. Okay, pull the sheath back down. Just place this here. Not really working. Okay. All right. All right, Mr. Smith. Just gonna sit you up a little bit. Okay. I'm just going to deflate your cuff and I'm gonna listen to the air around it, okay? So I would check my vent one more time, make sure that he's still hyperoxygenated. If he needed it again, I would go ahead and hit the O2 boost. Like this better out here. Okay. All right. Okay, Mr. Smith. Go ahead and let some of this air out until I hear air movement. Okay, and I'm just checking to make sure there's no stridor, no airway edema. Okay, and I'm also notating on the ventilator that there is a leak greater than 15%. So I know that I have performed my leak test. Everything sounds good, so we're gonna go ahead and push this air back in. And just give a listen again to make sure we got all the air back in, and also look at my vent to make sure that there is no longer a leak. Okay, so everything is good there. Put this back up. All right, Mr. Smith, well, it looks like we are ready to get this tube out, so I'm just going to continue setting up some stuff and then we'll be ready to rock and roll. So I'll get my nasal cannula ready.
Lord.
I'm like a bull in a china shop. Okay. All right. I'm gonna have my cannula over here. Sit it there. And I would make sure that it's in the packaging, obviously in a safe place. There. Doesn't want to stay. Okay. There we go. Okay. Make sure that I have my bamboo bag readily available on standby. Okay, so I place this at the head of the bed. All right. Section's all good. Okay. All right. So I'm gonna go ahead and get some of these napkins, more cloths. All right, we're gonna place this here. All right. So how we're gonna do this, Mr. Smith, is I'll have you take some nice deep breaths for me, okay? After 2 breaths, after that second breath, so the first breath, I'm gonna take you off the vent. After that second breath, I need you to go ahead and take a nice deep breath in. At the end of that, I'm gonna deflate your cuff, and then I'm gonna have you cough, okay? And then I'm gonna suction your mouth out, and then we'll go ahead and get some oxygen on you, okay? So I'll go ahead and just hyperoxygenate him. Go ahead and take some nice deep breaths in. Good. Okay, you're doing great. So while he's doing that, get that afterwards. While he's doing that, I'm gonna go ahead and start to take this off to get it ready. Okay, I'm gonna slowly peel these off of his face. All right, just keep taking those nice breaths for me. All right, let me grab this tube over here, get this. All right, well actually, you know what? We'll wait on that. Okay, So now what I'm gonna do, have you take that nice breath for me, okay? All right, so now I'm gonna go ahead and take him off of the vent, put it in standby. Grab my syringe, okay? Go ahead and take that nice deep breath for me again. Okay, and at the end of his inspiration, I'm pulling out the air and cough, 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 cough. Great job. Get rid of that. Go ahead and keep coughing. We're gonna suction his mouth out. Okay, making sure that we get everything deep in the back of the throat, the sides of the cheeks. Good job. Okay, can you tell me your name? Okay. And can you tell me where you are? Okay, take some nice deep breaths for me with that oxygen. There we go. Great, okay. So now I'm just listening for any stridor. Make sure that he sounds good. Okay, and I'm going to listen to breath sounds. And I'm checking the monitor while I'm doing that. So I'm looking at my heart rate, my respiration rate, my SpO2, my blood pressure, and my EKG. Okay, I don't hear any secretions in there. All right, Mr. Smith, you did a great job. Okay. All right. So now I would just go ahead and clean up my mess around him. I'd keep my vent in here on standby just in case if, you know, I started hearing stridor or anything like that. I would keep his suction here for him. And I would go ahead and let the doctor know that we've got him extubated. So I'm gonna go ahead and just reassess him. I'm looking at his heart rate, his respiration rate, his blood pressure, SpO2. I'm gonna listen to him again. Can you tell me your name? Okay, great job. I'm gonna listen to him one more time. Make sure that he sounds all clear and that he didn't aspirate anything. Okay. Great job. So I would go ahead and let him know that I'm gonna grab a bubble humidifier. I would notate his work of breathing, make sure he's good, he's not in any kind of respiratory distress. And once I make sure he's not in any respiratory distress, and I've went ahead and reassessed him, so I just listened to his heart rate, blood pressure, SpO2, respiratory rate, and listening to those breath sounds again. Okay. And obviously I would do that for one full breath cycle, but I'm going fast for video purposes. Listen to the stridor again, or for stridor again. Then I would leave him like this. So I would make sure that all the bed rails are up, that he's secure, and he's in a nice position. Put him at semi-Fowlers. Okay. Nice and comfortable, Mr. Smith. We'll get you a pillow too, okay? So then I would wash my hands and chart my procedure, and I would come back in 30 minutes to do an ABG on him to make sure that his gases are good and to check for stridor once more.